It is now March 5th, 2024. It's our last surgery of the day. This makes number 5. This patient presents to us from Pennsylvania. She has a herniated disc at L5-S1 on the right side, and she has horrible pain in her right leg. This is not a back pain patient. This is a sciatica patient. She cannot even walk. She's in a wheelchair. She's in so much pain. And we saw her MRI, did a Zoom call through our MRI review, and we realized she had a problem that we could fix, the herniated disc at L5-S1, and that was what was pinching her nerve. So we're going to try to go fix that today. Very nice lady, totally incapacitated. All right, I'm hitting some, that's the facet. Let's get an AP. And maybe a little bit too medial. The surgery will be done arthroscopically. The advantage of this surgery is no real bleeding like you do with open surgery. Yeah, too medial. And then let's go back to a lateral view. And the other advantage of this surgery is that we're not removing bones and ligaments out of her spine like the other surgeries do. Microdiscectomy is a surgery that the surgeon has to take the bones and ligaments. Is she responsive? No. I think we're okay. Shot? AP? Hopefully we're in the right spot. So the alternative surgery for this would be a microdiscectomy with or without fusion. The advantage of not fusion is obviously you're not fusing. Looks good. The advantage of microdiscectomy with fusion is you prevent future herniations, because the big problem with microdiscectomy is reherniation. Patients will herniate a second time, be back for more surgery. I can feel the herniation. All right, so here we go. We are going to do a discogram, but she is asleep. We're not doing this surgery for back pain, so I'm not as interested in back pain. Shot? I'm more interested in the herniation. Shot? And there it is. You can see it. Shot? There it is. Oh, wow, that thing's huge. There's layering of dye within the herniation. You can actually see it. And then the big herniation. It's on the right side. Everybody agrees this is the right side?
Yes, sir. Yes, sir.
Let's get started. Fire it up. If you have questions, ask. Otherwise, why don't you play the video for our audience on the Deuk laser disc repair and how it works. Keep in mind, we're not doing it for back pain today. For this patient, we're doing it for her leg pain. Shot? All right, we are inside the L5-S1 herniation right now, and we're putting our tube in so we can do her surgery. The surgery is done arthroscopically. What does that mean? It means it's done through a skinny tube with a camera and a scope. Fluoro out. We are at 5-1, everyone agrees. Right side. We always want to make sure we're doing the right surgery on the right patient. So we do timeout, which we've already done, several of them. And now we're going to go in and get this herniation out. All right, any questions from our audience?
At this moment, no current question.
There's first piece of herniation. So, will we have one big or many small? I don't know. I would say if I had to wager, it would be many small. Oh, here's something, but it's breaking apart. So what happens with a herniation is you get a tear in the wall of the disc and a big chunk of nucleus, there's a piece, comes out. There's a good sized piece, not giant, but respectable. The nucleus is the center of your disc. It should not ever come out. It's supposed to stay in the middle of your disc. Some people say it's like crab meat. I think it's more like uncooked shrimp. I say that because there's a difference between, between crab meat and shrimp. There's another piece. Louise, save those pieces so we can show the audience. Luis is going to put them all together for you. We have not gotten all of them out. There's more. What I was going to say is there's a difference between crab meat and shrimp. And if you live in the Northeast, you know that. Crab meat is, well, considered a greater delicacy than shrimp. Right? But there's another difference, and that is the texture, consistency. Shrimp is a bit thicker and more, more watery. Crab meat is drier, and I think it comes apart a little easier. But I believe herniated discs are more like shrimp than crab meat. That's just my experience. Any questions? You guys ready?
At this moment, no current questions.
Let's get her done. You played the DLDR video?
Yes, we did.
And there's the laser, folks. Now, what we know about this particular disc as opposed to some of the ones we've seen before. First of all, look how white and fluffy it is, right? That is a fresh herniation. This is not an old degenerated disc like we see in most of our patients that we do the surgery on. This is a fresher herniation. So what's different? Well, people with back pain for many years, 10, 20 years, they kind of deal with it. They take pills, they change their behavior, their activities, they modulate things. They try to ease up the back pain by just changing the way they live. And some of them will do, drugs, narcotic, pain pills, cannabis, whatever. I mean, a lot of people self-medicate, alcohol. The point is, all that time, these people are self-medicating, self-treating, not fixing, because they're suffering with back pain. They're hoping the pain goes away. They're being told by the doctors there's not much that can be done. So they're kind of just dealing with it. But that herniation's getting older, older. And there's a lot of inflammation going on, and it's making the herniation like worse. You know what I mean? Dried up. There's a piece of herniation right there. Anyway, with this herniation, because this is not a back pain patient, this is a leg pain. I can't walk. I'm living in a wheelchair as a young person patient. They're more motivated to get fixed than the chronic back pain patient. So you're seeing a younger herniation, one that hasn't been put off for years and undergoes chronic inflammatory changes. Oh, here's a nice piece. All right. We'll start a little collection over here next to Luis. We'll put the other ones there so you can start to see. But yeah, there's a big piece here still. It's breaking apart. It's breaking apart. It's breaking apart because, number one, it's edematous. It has a lot of edema. Oh, it's big. Oh, oh, this is it. Here it comes. Get over here, Henry. Oh, yeah. Oh, ho, ho!
Got that whole.
Woo! 2 in 1 day, baby. Look at that thing.
Wow.
Mamacita. That's like, oh, that's an inch and a half almost, right? Get it off of there. Smack its ass. Give it an APGAR score. There it is. That's the biggie. Oh, her leg right now is going, oh, I feel so good. Thank you, Deuk Spine. Henry, you going to get her video tomorrow?
Of course. I got that whole thing.
She came all the way from Pennsylvania to Florida for this surgery. She didn't want a microdiscectomy. She's been watching our surgeries and commenting. For those of you out there, you know who she is. I can't tell you her name, but she's been watching and commenting, and she knows she didn't want a microdiscectomy. She wanted the best, and she made it happen, and I'm proud of her. You know, I was doing some thinking today, and I shouldn't say this, because it's not a very nice thing to say. But I realize, I'll say it nicely, I care the most about the people that are my patients, if that makes sense.
Makes sense to me.
Yeah. Right? The people that trust us, come here, understand the value of what we offer, those are the people that I like and respect and care about the most.
Of course.
The people who don't come here, I don't have as much empathy for, especially if they know that we exist and they choose not to come. All right, that was a really nice herniation. There's still a little bit more we're going to get. L5-S1, tough. And by the way, this surgery I dedicate to, let's see, what's his name? He's always asking about L5-S1 paracentral disc herniations. Rashid? No. He was just on earlier, Henry.
Well, I was trying to recap. Was it Kieran?
Kieran.
Yeah, Kieran.
This surgery we dedicate to Kieran. Because Kieran's always asking me, what would you do for a patient with an L5-S1 paracentral disc herniation? Well, Kieran, that's this patient right here. You want to know what I would do? What you just see me doing right now. That's the best. Not interlaminar, not translaminar, transforaminal. Because we're not taking any of her bone out, we're not taking any ligaments out. We're literally doing this the best way you could possibly do it. By using the laser to clean out the herniation and the grabbers to pull it out. All right, I got less than 5 minutes left. Probably, look at all the inflammation, the red stuff. Dr. B, yes. 3 minutes to 5 minutes. Yep. This is the old stuff. Look at all that calcium. So it looks like she had a tear from a while ago and then got the herniation more recently, the big one. So this part is the old part of the herniation, the old part of the tear. So fresh herniation, more recent, but in a disc injury that's old. This may have been around since she was a kid. You know, kids do all kinds of crazy things when they're young, right? Jumping off of roofs. This is a pretty bad injury to her L5-S1 disc that she must have had. This part of the injury looks older. So, but the herniation definitely looks, you know, more recent, like in the last year and a half. When did her symptoms start?
Back in December.
December? Yes. Yeah. So, yeah, that herniation, the big one looks like December. Certainly matches. But some of the other stuff here is older. So this is a mixed injury. Some old, some new. All right, guys and gals, we are a minute away from being done. And I will take any more questions you've got, Henry.
Yes. We have a question from Fiona on YouTube.
Fiona, is that possible? Yes, we'll take it.
They asked, hi doc, what does a 7 or 8 millimeter thecal sac mean, please?
Yeah, 7 or 8 millimeter means that if it's in your neck, cervical, it means that you've got bad stenosis, narrowing. If it's in your lumbar it also means there's narrowing going on. The thecal sac is the white sac that holds your nerves in it, and it should be bigger than that. You should have more room for it. The fact that it's so narrow means you have stenosis. It means that the nerves are getting pinched, basically. Now, the radiologist, sometimes they won't say the nerves are being pinched, so they just comment on the narrowing rather than the pinching of nerves. And that's what's happening there. It's their way of saying something that patients won't understand, that doctors would understand. Why radiologists are that way sometimes, I don't know. They like to talk in a way that is above their patients' heads, because they don't want patients getting the reports and maybe, you know, doing too much of their own investigating. I don't know. I don't quite understand it myself. There's the end of the disc. I've just got a little more zapping to go and we're done. Okay, there's some fat. That fat is in the epidural space, just outside the annulus. I've cleaned up the annulus nicely. You guys can see there's a little hole there, and it's about 3 millimeters, maybe less now. And I'm getting rid of the last of the herniation laterally right here, and we're done. I mean, I just got 30 seconds and I'm done. So that went very well for her. And the reason why we saw earlier when I did the discogram, there was a layering of the herniation, remember that? Where there was dye kind of sitting in different parts of the herniation. It now makes sense. The herniation is not one age, it's multiple ages. So it's got multiple herniations. Therefore you have layers for like the cake, you know, different layers of the cake. There's the first, the second, the third. Those represent different herniations and scar zones from the herniation. All right, just want to get this last piece and we're done. Oh yeah. How gratifying. All right, that should be it. Let's see if I can pull it out, and hopefully I can, and we're done. So the laser frees up the herniation, and then we use the grabber to take it out. Oh yeah. Beautiful, beautiful. Any more questions before we wrap this surgery up?
At this moment, no current questions, but we do have a comment from Bo on Facebook
Oh, one more bite. Yes, Bo.
saying, I like you because you give me hope.
Ah, you're welcome, Bo. We like you too. I like you more if you come and get fixed. Like I said, I have a special bond with my patients. Oh, yeah. Man, she had a lot of herniation, didn't she? This is the older part of the herniation, by the way, if you're wondering. This stuff is more scarred up. And it's coming out in pieces. If I had to guess, this is about maybe a couple of years old, maybe a year old, 2 years old, something like that. Whereas that big piece is from December, just a few months old. Remember, herniations are not one-time events. They happen multiple events, okay? Now, let's see if I can get that last piece and we're done.
We have just one more question.
Sure, sure.
This comes from JMC on YouTube.
Yep, before you do that, let me just show you the nerve, okay? It's going to be right up there. And the fat, well, can't even see it. Well, there's the hole, and it was being held open by the actual herniation. We got rid of it, and now there's no more herniation there, and it's nice and clean. And we've lasered away the herniation. That hole is now 2 millimeters, and her body is going to heal that up on her own. It'll take a year to fully heal. 1 year. In 1 year, that will be closed up, and it'll be strong, and she can do whatever she wants. She'll be back to normal. Let's show everybody the herniations one more time.
Of course.
Can you guys see them?
Yes, we can.
Right here, a whole bunch of them. It's like a family of herniations. I really like this one. I got big hands too. That thing is massive. Yes. Oh, you want to take that to the pathologist? Great. All right. She's going to wear it around her neck. We should offer, what is that called? 3D printed? Like, you know, little necklaces of their herniation. That would be kind of cool, right? That would be cool. How do you got to scan that thing, right? There's got to be like a scanner, a 3D scanner, and then it creates like a CAD file, and then you can print up something and you give it to the patient. I like that. All right, well, is there any more questions?
We have 2 questions.
I'll take them.
This first one from JMC on YouTube asking, what are your thoughts on interventional spine doctors? I have an L3 to 5 fusion and the L5 left screw has broke. One doctor says to operate it. The other says it's not worth it.
I think you asked earlier about your screw that was broken. Yeah, so I told you what to do. You need to see me, okay? Because you don't want to operate on a broken screw that doesn't need to be operated on. Remember, the screws are there temporarily. They're there to hold your spine together while you fuse. So if you fused, then you don't need to replace the screw. You don't need to do anything with the screw. Leave it alone. On the other hand, if you have not fused and the non-fusion is causing your pain, then you need to have that fixed. But chances are that's not the cause of your pain. 90% chance something else is causing your residual pain and symptoms. And for me to figure that out, I got to see you. So I do not like interventional pain management doctors most of the time because they don't want to fix the patients. They just want to take your money and keep having you come back every 3 months and get more pills or shots. We like to fix patients here at Deuk Spine so you don't come back. All right. Last question.
Last question from Bo on Facebook asking, I asked a bit ago, do I call your office to get an MRI here in Texas? I asked earlier, and you only talked about getting it to you.
Sorry, Bo.
I did that a couple years ago. But
misunderstood. So you need to talk to your primary care doctor, Bo, to get an MRI. If I order the MRI for you, your insurance will not cover it. They won't pay for it. They're going to deny it. And they're going to say, you can't order an MRI on a patient you haven't seen. And they'll be right about that. So the best thing for you to do is to go to your primary care, Bo, and ask to get an MRI of your back or neck. And then once you have it done, fill out the form on our line and send it to me for review. All right, been nice hanging out with you guys today. And this surgery went very well for this young lady. I hope she's going to do great. We'll see you all next week.